patients' approach to healthcare here in Wales has changed quite a bit in the last 18 months to 2 years. And the proof of that is in the figures. Many more of us are now considering going private when it comes to our operations than we did before the pandemic. I'm now joined by Matt James from the Private Healthcare Information Network. Thank you for joining us on the Great British Breakfast, Matt. Firstly, I just want to ask, what changes have you discovered about how patients in Wales are treating their healthcare and operations now?
So looking at the private sector data, it's clear that more people are now buying the common procedures such as hip and knee replacements and cataract surgery on a self-pay basis. That's where people fund the care from their own pocket rather than by using insurance. And the numbers are clearly up in 2021 versus the same period in 2019.
So would you say that that means that the NHS is now under less pressure because people are going private for their healthcare?
I'm not sure we could say that. I think the NHS will continue to be under significant pressure in the post-pandemic period. And whilst private healthcare will probably do the best it can, independent hospitals will do the best they can to help the NHS by making capacity available, but also some people will choose to go private. The reality is that the scale of private healthcare in this country is so small compared to that of the NHS that it won't be very visible from the perspective of the NHS.
Why do you think people have made the change then towards private healthcare? Because, you know, is it more affordable than perhaps we may have thought?
Changed a great deal, Lily. I think probably what's changed is people's attitude toward paying and their willingness to pay when they've been waiting for a long time for treatment now. So nationally, across the UK, we think about 3.5 million procedures were delayed during the pandemic period. And in private healthcare itself, over 250,000 procedures were delayed during the pandemic period. Now, if you're a patient waiting for hip surgery or for a cataract procedure, you've got problems. You've got pain, you've got lack of mobility, you've got a lack of vision, and you need that sorted out. So people whose treatment was delayed during that period are still looking for that treatment. So for those people, where everybody makes a balance between should they stay with the NHS or should they consider paying from their own pocket, which is expensive and which is confusing for many people, probably people's line at which they make that decision will just shift slightly. So we've done a poll through YouGov, which showed that around a quarter of people in Wales, about a fifth across the UK as a whole, are now willing to consider private treatment who perhaps weren't before. And that is largely attributed to frustration with the waiting lists. But at the same time, people see cost and the sometimes confusing pricing in private healthcare as one of the key issues that would prevent them doing so.
Amazing. Thank you for joining us on the Great British Breakfast. That was Matt James from the Private Healthcare Information Network. So as many more of us are considering going private now, you know, we need to be sure that we're doing our research to make sure we're across all the cost options and the options that we have for these operations to ensure that we are getting the best deal.